There are 359 active cases of coronavirus in Victoria as of today, with 5 new cases since my last report. That is the lowest number since June 12. In terms of reported cases, there were 4 cases reported that day. All 5 cases are linked to known outbreaks, and there was 1 reclassification. There have been, I'm sad to say, 787 Victorians die as a result of the global pandemics, 3 since my last report, 1 male in their 60s, 1 female in their 80s, 1 male in their 90s. All of those deaths are linked to aged care. And of course we send our condolences and best wishes to those 3 families. There are 49 Victorians in hospital, 8 are receiving intensive care and 4 of those 8 are on a ventilator. A total of 2,668,796 test results have been received since the beginning of the year. That is an increase of 6,807 test results since yesterday. That number is within a few hundred of last Monday's number, which essentially reflects the Saturday testing. I don't want to necessarily speculate too much, but it wasn't the greatest day in terms of weather on Saturday. That number still, because of the number of positives that it found, is still a robust number. But I will again take this opportunity to appeal to every single Victorian. If you've put off getting a test over the course of this weekend and you've got symptoms or you had symptoms, please go and get a test today. As I've said a few times now, I don't think case numbers are going to hold us back from being able to take safe and steady steps toward that COVID normal, to continue opening up, as we outlined yesterday. But what could be a challenge for us is if we don't see people coming forward and getting tested, and if we start to have doubts about whether we've got the most complete picture, that can be a real challenge. Now, of course, Jerome is here today and is going to talk a bit about testing, some of the targeted work we've done where there's been some outbreaks, particularly in the southeast and the inner west. Later in the week, not today, but later in the week, Jerome will be back to talk about some changes to testing and some really intensive efforts that we're going to make towards getting the most complete picture. That's not an invitation, though, for people who've got symptoms not to come forward. That's about adding to a picture where we have confidence. It's about taking it to another level. But that's for later in the week. In the meantime, any symptoms whatsoever, don't wait a day, don't wait an hour. Please go and get tested. There's, in many respects, the most valuable commodity at the moment is you getting tested. If you're positive, we protect and support you, we protect and support your family, and we protect every family, because you're then not, often unknowingly, spreading the virus to other people. Please get tested, and get tested today if you've got any symptoms whatsoever. In terms of cases with unknown source, so mystery cases, 4274, that is an increase of 1 since yesterday's report. There are 60 healthcare workers who are active cases. As we always do, we wish them well, and we thank them and all of their colleagues, many tens of thousands of colleagues, for the amazing work they do every single day. In terms of regional metro split, there are 9 active cases in regional local government areas under the 3rd step restrictions. The rolling 14-day average to 27 September is Metro 20.3, Regional 0.6. Across the state, therefore, it's 20.9. That is a very, very significant set of numbers. We are well ahead of schedule. Again, notwithstanding the fact that there is that time lag that we have to wait and see how the virus presents and what the effect of changes announced yesterday and any other changes we might make are. I know that's frustrating. With those numbers, people I know would love to move to take even further steps as quickly as possible. But this thing is silent, it moves rapidly, and there is that need, that absolute need. There is simply no choice. You have to wait and see what happens, because it is hidden for 2 weeks, 3 weeks before you'll really get a complete picture of what the impact in terms of virus transmission and therefore virus numbers and therefore risk is in real terms. You just can't know today what the impact of yesterday's announcements will be, at least for 2 to 3 weeks' time. In terms of aged care active cases, there are 182 that are still active, and active cases in disability facility settings, I'm advised there are 4, all of whom are members of staff. Now, there have been, as there always is whenever we make changes, everyone works as hard as they can to put as much information up on the website, to provide as much clarity as we possibly can, but whenever you make rule changes, there'll always be grey areas. Any business who needs further information, further clarification, because I know the absolute overwhelming majority of businesses across the state want to do the right thing. They want to be as COVID safe as they can be, and it's very difficult either in a press conference or sometimes even in a lengthy media release to necessarily go through every single question that might need answering. I would commend to any business who needs any clarification, Business Victoria 132215, 132215. There are extra operators. I can't guarantee that your call will be answered within a second, but there are extra operators, and if they can't provide you with an answer on the spot, that is a good place for your query to be logged, and we will work as hard as we can, as fast as we can, to get the public health team to look at any question that might need answering. This is just the nature of whenever you draw lines or write lists, there will always be people on both sides. There will always be need for clarification. I understand we have provided some clarification overnight on a number of matters that were raised yesterday. There may be others that need further clarification, and that's exactly what our officials are there to do.